My name is Heun, I'm a consultant psychiatrist, and I'm talking in the series Mental Health Explained of Global Psychiatry Archives, and today I'm talking about a very rare disease which has been described in the early 20th century, first case at the end of the 19th century, and the people who have been most involved were German Dr. Kleine and another Dr. Levin. It's a very rare disease with periodic somnolence and morbid hunger. So people would eat up to 3 times what they normally eat, and they would also sleep between 18 and 20 hours a day. Usually it starts in the mid-adolescence, let's say about 15 on average, and interestingly, the disease only lasts up to 12 years. There's some variation on that. You can have people who started having this disease at the age of 4, and the oldest description is a patient at the age of 80. The clinical features are long-lasting episodes of hypersomnia lasting days or weeks, and then at the same time excessive food intake up to 3 times of normal, which then leads to an increased body mass index. This may lead to snoring. However, if controlled for the body mass index, the snoring is not more than other people who are overweight. Another feature of these patients with Kleine-Levin syndrome is sexual disinhibition or hypersexuality, which in males can result in excessive masturbation, contact or inappropriate contact to patients, other co-patients or staff or people who would normally not respond to these advances, and who the patient as himself wouldn't contact in other circumstances. So usually the episodes last for a couple of weeks, and they then completely, and this is the interesting part, disappear. During the well episode, the patients are more or less the same as others. They might have some more cognitive dysfunction, they might be a bit slower, they might be a bit more confused, more irritable, restless, sometimes euphoria is a symptom, or hallucinations, some delusions, and schizophreniform states. These things can rest during the more or less well episodes, but can be exacerbated during the episodes of hyperphagia and hypersomnolence. In this respect, this is described as a parasomnia, and so the definition is that the episodes occur between 1 and 6 months, last for a couple of days or a few weeks, and between the attacks the patients recover completely. And due to the fact that these symptoms can be confused with other mental health disorders such as bipolar disorder or depression or psychotic symptoms or other neurological symptoms, then there is a need for brain imaging, there's a need for an EEG. However, the EEG might show some slowing in the brain, so that the alpha rhythm is a bit slowed. Alpha rhythm is the normal awakes rhythm of the brain. Sometimes people have a couple of spikes, but there's nothing which is really characteristics of epilepsy. So other psychiatric disorders, depression might be a comorbidity, but usually the episodes are quite clear-cut, so that they recover quite easily. So in this respect, other mental health disorders are quite unusual in these cases. So the treatment is quite difficult. As usual in psychiatry, everything has been tried, and certainly in hypersomnia, stimulants like amphetamine, methamphetamine have been tried, with little benefit. They only improved the alertness, but not the hyperphagia as expected. Lithium had some effects on the long term, as well as carbamazepine. So the idea was more or less treated as an anti-epileptic or a mental health disorder which is recurrent. So that's a choice of lithium or an anti-epileptic. And some case reports say there have been some improvements. Other medication have been tried. What's also important to say is that usually the hypothalamus is a part of the brain which affects appetite, sleep, and activity or alertness. So in this respect, there were some brain imaging studies looking at the hypothalamus or the thalamus, but there's not much change, and only a few case studies have reported some abnormalities. So let's say it that way. For preventive measures, some people have tried lithium, carbamazepine, or valproate, and now comes a very unusual feature, which is the fact that in many cases, after 10, 12 years, the disease completely stops and people are fine again. So why do I tell all this? I think it's very important that people with schizophrenia, people who treat people with mental health disorders or who have neurological clinics are alert and know about this very rare disease. So Kleine-Levin syndrome or disorder needs attention, and it's quite clear clinical diagnosis if other mental health disorders are excluded. Thanks for your interest, and if you are interested in our series, please just subscribe to the Global Psychiatry Archives series. Thanks for your interest, and goodbye, and have a nice evening.